So my name is Dr. Jeff Barke. I'm a board certified family physician and I practice in Orange County, California. And I've been in practice for about 30 years. And of late, I have had the opportunity to give my voice that other physicians, I think, are appreciating, because there's thousands of physicians across the country whose voices are being silenced in this whole COVID-19 issue that's been going on now for the last, 60 days or so.
I know that you have been experiencing, the COVID thing now, as we all have for over 2.5 months with the lockdown.
That's right. Yeah,
so
that's right.
What have you seen, based on what we have been told? How does that differentiate what the mainstream media is showing us and what you know?
Well, here's the thing, Ashley. I think most importantly is people understand that our economic system in this country and around the world has pretty much been shut down. But what they don't realize, that part of that shutdown has also included the shutdown of the healthcare system. And what I mean by that is I've spoken with doctors all over the country, actually all over the world, and their volume has plummeted. I spoke to a psychiatrist just a few days ago, and he's seeing 80% less patients than he was. And that's because patients are scared to come in. This is a psychiatrist, and keep in mind, this is a psychiatrist that takes care of very ill people that need to be medicated, that are barely able to function in society if not for his care. And now they're not coming into his office. And this is repeated across the country by thousands and thousands of doctors. He mentioned to us on a conference call that he has prescribed more benzodiazepines, and that means Valium and Xanax and medications like that, than he ever has in his entire career. And that's because his patients aren't coming in, and they're suffering from tremendous anxiety. And he doesn't really have any other option at this point, because they won't come in for their routine appointments, than to prescribe a medication to try to calm them down and help them with some of their anxiety and panic that is going on. That's just psychiatry. We talked to a cardiologist that had a similar situation, where he stopped doing echocardiograms, catheterizations, and all kinds of non-invasive testing. So these are things that he does routinely for congestive heart failure patients, for patients that are having chest pain that might need an angiogram or a stent placed. And these are patients that aren't getting care. So we're going to see, as the healthcare and the economy opens up, we're going to see a lot of patients that have been permanently harmed, some of whom have actually died because of not going in for local care. I have a patient that I'm aware of in my community that a friend of mine treated, who died of intestinal obstruction. This was a 61-year-old male who was having abdominal pain, and he was so scared to go into the hospital or go to the doctor's office that he decided not to go in, and he just stayed at home and suffered until it was too late. And by the time he showed up, he was septic and ultimately died from something that nobody should ever have to die from. There was a study out of Ontario, Canada, where 30 people died awaiting cardiac surgery, cardiac procedures, because their procedures were deemed non-essential. So we're all aware of the economic shutdown and how businesses are being hurt, how 30 million plus Americans are unemployed. But less talked about is this idea that the healthcare system is shut down as well, and people are directly being harmed as a result of that.
Absolutely. Yeah. So are you not seeing the numbers that we are being shown in the media? I mean, because every time I turn it on, it's like death toll is going up and up. And so,
So, the death toll as it relates to COVID-19, I'm a little bit suspicious of some of the numbers, because I've learned from my physician colleagues and people that work in the hospital that the federal government, and I don't blame them, and I get why they're doing this, but the federal government has offered financial aid to hospital and hospital systems that were inundated with treating COVID patients. But the caveat is that they have to code appropriately that a patient who died or needed care was a result of COVID-19. So hospital systems and physicians are incentivized to code for COVID-19, and we're seeing multiple cases where somebody comes into the hospital, dies of a heart attack or some unrelated condition, and they're coded as COVID-19 so the hospital can get reimbursed. So I'm a little bit dubious about the numbers that say close to 100,000 Americans have died. I'm not saying this isn't a serious virus. It is. I'm not saying this isn't dangerous. It is dangerous. But from my perspective, more dangerous is some of the government tyranny that's going on, that telling people that they can't go to work, telling people that they're not allowed to go to church to pray, telling people that they can't use recreation like open beaches and parks and national parks and things of that sort. So that's the part that I think is disturbing. I think we've way overreacted to this virus, and we're going to see, looking back, that the cure to this virus, the self-imposed cure, is going to be worse than the virus itself.
So you don't feel that this isolation is helping, or do you feel like that the whole idea of herd immunity and letting nature take its course is more important to do?
Well, nature take its course is one thing. I think we need to protect the most vulnerable. So older Americans that are 65, 70 and older need to be protected because they're at very high risk. People with pre-existing conditions like emphysema, COPD, heart disease, and so forth, we need to be very careful about them. But yes, ultimately, the way we get past this virus is through herd immunity. And we've done exactly what we shouldn't have done. We've taken the healthiest Americans, the youngest Americans, and our children, and we've quarantined them in homes, and they're not able to go out and develop that herd immunity. You can almost count on one hand the number of deaths that have occurred in Americans that are younger than 40 years old. 40 years old and younger, you have a greater chance of being killed in an auto accident just about than you do dying from COVID-19. But we're telling all those young, healthy people that they too need to stay out of the public, stay home, and not go to work. So until we open up the economy, allow the young and healthy herd to be exposed and to get over this virus and provide immunity and cover, if you will, for those that are most at risk, we're going to continue to struggle. So we talked early on when this virus first came out, and there were a few healthcare systems that in fact were being overwhelmed. That was in New York, New Jersey for a time, and for a short period even in Seattle. And the idea was we were going to quarantine and shelter in place to allow healthcare capacity to come back online. But this has now been 60 days, and there is plenty of healthcare capacity throughout the country with almost no exception. And so this original idea of shelter in place so healthcare can come back online, we've taken it way too far. We've caused some of the greatest harm we've seen purposefully in our nation's history. Over 30 million people now are unemployed. I read an estimate recently that 40% of those folks that are now unemployed will not have jobs to go back to. We see the highest suicide rate than we've seen since the Great Depression. We see mental health issues skyrocketing. Our local sheriff here reported that the 911 system was being overwhelmed with domestic violence calls, drug and alcohol abuse. I mean, if you think about it, even some simple things, and I didn't realize until I spoke to the psychiatrist, Alcoholics Anonymous, for example, those meetings are shut down, or they're trying to do them by Zoom and do remote meetings. Narcotics Anonymous, et cetera. So keep in mind, Alcoholics Anonymous is a wonderful organization, the best way ever invented for somebody to get sober and stay sober. But now that close companionship of meetings and the personal touch is now missing for millions of people. And as a result, we see drug and alcohol abuse skyrocketing. And in California, which is where I live, our governor has just done some things that seem very arbitrary and capricious. So for example, he closed down churches and called them non-essential. He prevented people from getting non-essential, so-called non-essential surgeries. But at the same time, he allowed liquor stores to be open. He allowed marijuana dispensaries to be open, and he shut down people's Second Amendment right in California to go purchase a firearm. At the same time, he was advocating letting criminals out of jail because of the risk of COVID-19. So some of these moves just don't make a lot of sense and are unfair and, in my mind, a bit tyrannical and autocratic. And people are pushing back now, and thank goodness for that. You know, we need to push back against our government, remind them that our rights come from our creator, not from our government, and that we have constitutional rights, of liberty and individual risk assessment, that we're each sovereign, and that we are supposed to be limiting the scope and power of the government, not the other way around. And I think we, the people, if you will, have had enough. And I'm proud and honored to have the opportunity to lend my voice, which I think represents thousands and thousands of physicians across this country.
So would you say right now it's not so much a health issue versus a political issue?
I don't want to believe that this is a political issue, but it certainly seems like it's divided along political lines. I think it's a misinformation issue and it's a fear issue. So we see every night on the mainstream media news just fear after fear after fear. If something unusual happens, like a young person dies of COVID-19, that's flashed across the screen. If there's an opportunity for a cheap drug that has a wonderful safety profile, like hydroxychloroquine, to be used, the media immediately shoots it down and brings on experts to say that it's a dangerous drug, even though it's been used widespread since the late 1950s and safely. And if used judiciously and carefully, it's a wonderful product when combined with zinc and zithromycin. So I don't know why the media is continuing this fear-based narrative. And I know some people believe it's because the more fear and the more shutdown there is and the worse our economy is, perhaps the better chance that our president will be unelected. I hate to believe that that's their underlying motive, but sometimes it's hard not to believe that when what we see is going on in the reaction by many of our governors.
Mm. Okay. So I heard from another interview, Dr. Zach Bush said, you cannot die from COVID. You can die with COVID in your system, but you cannot die from it itself. What do you say about that?
So I don't know Dr. Bush, and I haven't heard what he said, so I'm not sure I fully understand, but there's no question that COVID creates a reaction in our body, and our body reacts to the virus in a way that's very destructive. It's an inflammatory condition that it creates in our body. That's why more and more doctors, when they treat it, are using anti-inflammatory medication like prednisone, for example, and certain supplements that reduce inflammation. So I guess there's some truth to that. The virus itself doesn't kill you, if you will, but it's the reaction to the virus and the effect of the virus that ultimately has, devastating consequences, particularly in the elder. So older folks, it's definitely a dangerous virus. Younger folks, not so much, especially our children. Many of people that are younger will develop this virus and not even know that they have it, or develop very mild symptoms and recover from it real fine. I'm treating a patient right now for COVID-19, tested positive, fever, difficulty breathing, and so forth. And literally 24 to 48 hours on hydroxychloroquine, zinc, and zithromax. I called him up earlier and he said, his words, he said, "Doc, it's like a miracle. My fever is gone. I'm feeling so much better. And thank you." So I think especially early symptoms and mild symptoms of COVID-19, hydroxychloroquine is safe, it's effective, and I've had great luck with it. And I know physicians all over my neighborhood and all over the country that are having similar situations. There was a report out of France that the hydroxychloroquine prescription has jumped 7,000% over the last several weeks as a result of physicians prescribing it. Yet a study comes out in the most ill patients that shows that it doesn't work very well. And I'm not doubting the study, but what I am doing is saying the decision to treat is really between a doctor and a patient based on the data, experience, knowledge, and wisdom of that doctor. And I see doctors using hydroxychloroquine successfully, especially for mild symptoms early on, and also when mixed with zinc and zithromax. And most of the studies, the widespread studies I've seen, don't mix the hydroxychloroquine with zinc, and I think that's a very important ingredient in helping heal somebody and allowing the medication to work properly.
Why is not every expert on board with hydroxychloroquine? Hydroxychloroquine.
However you pronounce it.
Yeah.
Hydroxychloroquine. I don't know, but there's a lot of frontline doctors around the country and around the world that are using it. And some of it is anecdotal evidence based on their own personal experience. Some of it is some studies that were done early on, both in China and France, Thailand, et cetera. And I don't know whether you use it or don't use it isn't really the issue, but for the first time in my career, I've been practicing over 30 years, I now get phone calls from pharmacists questioning my prescription. So I prescribe hydroxychloroquine, I get a phone call back from the pharmacist wanting me to justify the use of a medication that I use in a patient. Keep in mind, hydroxychloroquine has been around since the late 1950s. It's used extensively in patients with rheumatoid arthritis, systemic lupus, and other autoimmune diseases. So there's literally hundreds of thousands, if not millions of patients around the world that take this drug safely. It also is used extensively for malaria prevention. So if you were to travel, for example, to the game parks in Africa where there's malaria and you wanted to be protected, we put you on hydroxychloroquine as a preventative dose. And this is done routinely. There's other drugs we use as well for malaria prevention. So this notion suddenly that hydroxychloroquine now is causing death and disability and all kinds of problems is just nonsense. That's not to say you don't have to be careful and you don't have to know what you're doing. Of course you do. You need to assess risks in your patients individually, just like we do with every other medication or treatment that we prescribe, and then make an educated decision. But for pharmacists and others to now be questioning physicians on how they treat patients, to me, just seems pretty arbitrary.
Do you know how many deaths are occurring in Los Angeles County still, like weekly, from this?
The death rate is very low now. It's reduced significantly. Most importantly, is the hospital systems have plenty of capacity in Orange County. It's almost a ghost town at most of our hospitals. I've spoken to doctors and nurses around the country who have been furloughed or laid off because there's just not enough work. So there's plenty of healthcare capacity. And if it's true, and I believe it is, that the path forward is to allow young and healthy people out and about and back to work, so ultimately they can achieve herd immunity, then this continued shelter in place is clearly causing a lot more harm than it's solving. And I think enough is enough. It's time to open up our country.
Do you see that once we open up, do you foresee that it's going to spike again?
Well, of course it will, because we've locked people in their house. They haven't been exposed to the virus. And now we're going to open up the country, and now they'll start to get exposed. So this idea of flattening this curve to reduce the deaths for healthcare capacity was correct for a time. But the area under the curve, which represents the number of people ultimately that are going to die from this, is not going to change by keeping people locked in the house. The virus isn't suddenly going away like some sort of, smoke screen that's going to settle down and now disappear. The virus is going to still be there, and people are going to continue to get exposed to it. So the ultimate number of people that are going to perish from this virus is going to be the same whether we open it up or don't open it up. What's going to be different is our economy and the harm that's being caused by, for the first time ever, mandating that healthy people be quarantined. We've never done that before. I think there was a time during the 1918 Spanish flu influenza, for a time we asked people to be quarantined. But, a healthy society takes folks that are ill and quarantines them, and those that are high risk, we protect them. But a tyrannical government, an overreach of a government, quarantines the healthy and the healthy herd. And it's nonsense as far as I'm concerned. It's time to open up our economy, and we need to get our children back to school as well.
And with that, this not new, but the testing that's coming out, the antibody testing, is that something that we should be considering in any way to do?
I'm all in favor of testing, and there's literally hundreds of tests now that have come on the market, and they have variable efficacy. Their abilities to detect and their sensitivity and specificity is all over the place. I'm not opposed to testing. We do extensive testing in my office, but testing is not in lieu of opening up our country. Testing should be used in specific situations for employers that want, for schools that want, for a sense of safety, to baseline so we know where we're at before we put people back to work. I'm all for testing, but testing is not the solution moving forward. Testing is interesting, but it's not that important as far as I'm concerned.
Yeah. So, well, then can you touch this whole thing? Everyone has like all these different opinions on masks, right? And the more information that's coming out, different narratives. I see more people not wearing masks than others wearing masks, and then those who aren't wearing masks are getting death eye from those who do.
Yeah. Shaming.
So can you speak on masks and how effective are they to keep COVID away from us?
Right. So there's very little science to support the widespread use of the public wearing masks. There's been numerous studies that have been done in the past on influenza, for example. And the influenza virus is about the same size as the COVID virus, in the ballpark of 120 nanometers, whatever that is. It's super tiny. And so a mask, unless it's an N95 mask, it's going to go through a typical surgical mask or some of the cool cloth masks that you see people bringing on the market and wearing with different designs on it. The virus is going to go through that mask like air through a screen door. And so the studies that have been done in the past with influenza show very, very limited use of mask wearing, that it really doesn't offer much benefit. And I don't have a problem if somebody wants to wear a mask because they feel better wearing a mask and it gives them a sense of safety. No problem at all. But I'm a scientist, and I think the science is very, very limited. Also, when my wife and I are out and about and we see people wearing masks, 9 out of 10 times those mask wearers, they're adjusting the mask, they're scratching, they're uncomfortable, they're rubbing their nose and so forth. And as soon as you touch that mask, you render that mask completely useless and arguably even counterproductive. Now, an N95 mask is a specialized type of mask that is worn and is required to be fitted. So if you are a healthcare provider, for example, and you work in a hospital and you work with COVID patients, or you're an ICU nurse and you work with COVID patients, and you have an N95 mask that is specifically fitted for your face and you're used to wearing it and you have other personal protective equipment, I get it, makes sense. But the primary reason, for example, a doctor in an operating room that has one of the typical surgical masks that you see on TV or whatever, that's designed to prevent him sneezing or coughing and having spit and bacterial substance that will go into the wound. It's not designed to protect the patient from viruses. It's designed to prevent them from bacteria, which are much larger than viruses. So the science is sketchy. I don't think wearing masks for the general public is necessary. It may even be counterproductive. I see people jogging with masks on. That makes no sense to me. I see people riding their bicycles with masks on. That makes no sense to me. And California crazy is people driving solo in their car with masks and gloves. That's crazy town. That makes no sense to me at all.
Yeah, well, thank you for that. I mean, I know everyone has different opinions, and a lot of people are still in a lot of fear. And if you're not in fear yourself, you are being told to be feared, right? To be in fear.
Absolutely. Even the CDC came out recently with a back to school guideline, and it suggested that our children should be wearing masks in school. Now, I don't know if you have kids, but my kids are grown. And the idea of a second or third grader or first grader wearing a mask in school, are you kidding me? Those masks are going to become slingshots across the room.
Yeah.
And the kids are not going to keep masks on for any length of time. And of course, they're not going to wear the mask properly. They'll have their hands all over the mask. And that makes no sense to me at all. Not to mention that our children are the least vulnerable and they should be back to school doing their thing. There's no reason for children to be socially distancing. There's no reason for children to be wearing a mask because they are literally the healthiest of our population. And the statistics clearly show that the number of deaths in children are just ridiculously low. A kid has a greater chance of dying in a car accident on the way to school than they do from dying of COVID-19.
How does this relate to or compare to the flu? Like how many people die from the flu season, and has this exceeded that?
So it depends on how you count. So like we talked about earlier, this almost 100,000 American deaths, I'm a little bit dubious of the numbers. I'm not sure that it's an accurate number. I think a lot of those deaths are COVID related, but not people that have actually died from COVID. I think a lot of those deaths are people that have been coded as dying from COVID, but they died of something unrelated to COVID. So I don't think the numbers are as high as we're being told. Also, it depends on the flu season and it depends on the age. So for example, with young kids, like we've talked about, less than 40, this is no more dangerous than an annual influenza season. Above 40, and certainly our older Americans, yes, it is as dangerous and more dangerous than influenza. So we must protect the most vulnerable, but at the same time, we need to be aware that this virus pretty much spares the younger population.
But so I know I'm in my 30s and I'm not so much concerned about myself, and this is the conversation I have with people around my age too. I'm concerned of if I was carrying it to see my parents and passing that on, right?
Right.
So what do you have to say about that? Like, yeah, I feel okay, I'll be able to move through that. I'm healthy.
Yeah, there's very little evidence that there's asymptomatic carriers that just crop dust the rest of the world and spread virus around. There's little evidence to support that. And so I don't think that your parents have much to worry about if you're not ill to go over. I think that's where testing may play a role. So you can test yourself and just be double sure that you're not carrying the virus, and then you can safely go visit your parents. But there's very little science behind the notion that there's a bunch of us that aren't sick, that don't know that we're sick, that have this virus, and we're just simply spreading it around town. So I don't see that happening a lot, and the studies don't support that.
So when you say you can go get tested to make sure you don't have it, that's the antibody testing?
You could, sure. So there's two basic types of tests. There's the Q-tip up the nose test. That's really designed to detect virus that's in your body. It's called a PCR, polymerase chain reaction. So it's looking at the viral RNA, detecting viral RNA. That's a test that usually takes 24 to 48 hours. And then there's the antibody test that uses blood that can detect IgG. Those are memory antibodies that you've been exposed to it in the past and now you've recovered. Or IgM antibodies, which are acute antibodies, which means your body is currently fighting off some sort of infection. And there's a variety of these tests around. The antibody test, there's some quick tests where you just poke the end of your finger and get a drop of blood, and within 10 or 15 minutes, you have a result. And then there are other tests where you draw your blood like you normally would if you had a blood draw, and that's sent to a lab to be processed to find those antibodies as well.
And are they accurate, you would say?
So it depends on the test. You know, there was this new Abbott test that came out where you have a machine and you draw the blood and you put the blood in the machine, and 15 minutes later you have a result. And I read a recent report that it has a 30% false positive rate. So that's pretty high. And I'm not sure, even though we were proud of Abbott Laboratories and we're excited it was an American company that came out, I think there's a lot of work that needs to be done to prove the efficacy of that test, the sensitivity and the specificity. Okay. So we're told that the virus will come back in the fall. What can we do in between to prepare or stay out of fear? Or what do you recommend? It's a good question. So I don't know if the virus is going to come back in the fall. I suspect a few days after the election, whoever may win, we're all of a sudden going to stop talking about this virus and we're going to get back to normal pretty quickly. But if this virus does come back, there's nothing more important than how you take care of you. So making sure that you're eating clean, making sure that you're getting exercise and staying fit, keeping your weight down. I think there's a group of supplements that you should be taking that make a lot of sense. And for example, vitamin D we know is really important in immunity, in heart health, in mental health, in cancer prevention. So making sure your vitamin D level is tested and kept up at the upper limits of normal. We know that vitamin C has some anti-inflammatory properties. And I know of some doctors that are using IV vitamin C as part of the treatment protocol for COVID-19. So I recommend in general, if you're not already taking C, that you should talk to your doctor, but you should consider taking up to 3,000 to 5,000 milligrams of vitamin C daily. So those are two supplements that I think make sense. Fish oil is a terrific anti-inflammatory supplement as well. I recommend that. But outside of supplements, most importantly, is super clean, healthy eating, physical fitness, reducing stress, good sleep, getting outside and getting some sunshine. All those are really important components of taking care of yourself and preparing yourself for the battle. You know, it's like you're a warrior and you're about to go into a fight. So you want your body to be strong so you can endure this fight.
And from your opinion, when the restaurants open up, are you going to go to a restaurant? Those people who are in fear?
I'm going to go. Yeah,
okay.
Absolutely. Our restaurants here in Orange County are just starting to open up. I haven't been to a restaurant yet, mainly just because of a timing and it's Memorial weekend and so forth. But absolutely, I will go to a restaurant without fear. And, you know, the problem is obviously how exactly do you wear a mask in a restaurant if you're trying to eat food? And that doesn't make any sense to me either. So, yeah, no, I'm not fearful. I keep myself fit. I take supplements. I eat really clean. I'm in a relatively young age group that even if I were to get the virus, I wouldn't be happy. But I'm confident that I'll be able to survive the virus. And not to mention that, you know, I have physician friends that will not hesitate to use hydroxychloroquine, zinc, and Zithromax because I think it is very effective, especially for mild symptoms early on.
Okay, good. Great to know. And what is the last thing that you would leave people with who are in a lot of fear, who are still in all that, like, is it this or is it that? And I'm uncertain and I don't want to walk outside. Like, what can you say to them, or us?
Turn the television off. And go live your life. Life is risky. We don't know what tomorrow is going to hold. We don't know if we're going to get in a car accident. We don't know if our genetics are such that we're going to end up with cancer. We have no idea. We don't know if we're going to have a heart attack. We don't know. And for us to suddenly, as American people, to be living in fear, in part because we're told to, is just not who we are as a people. And even 100,000 Americans that have died, our population is 350 million. The chances of any one person, regardless of the age, dying from COVID-19 is tiny. And so if you use general precaution, you are careful not to touch your face, wash your hands very good, use hand sanitizer, you should have every reason to believe that you should be safe. And so don't live your life in fear. That in and of itself is not healthy.
Great. Well, thank you so much for taking the time to speak with me and to speak up with your perspective on all of this. I appreciate it.
My pleasure. Thank you so much for having me.